Hi, my name is Gilda. I'm 72 years old and I had my right hip replaced. I was having problems for over a year and kept procrastinating, thinking it would go away, and it was just progressively getting worse.
Before recommending joint replacement surgery, I follow the 3-strike rule. The first strike and the most important strike is the patient telling me that the pain interferes with what they do on a daily basis. It interferes with their activities of daily living.
I couldn't bend, I couldn't walk without pain. I was in total agony, absolute total agony. So I found Dr. Karkare and decided to call him, make an appointment and see if something could be done. And he told me absolutely he could take my right hip out and put a new one in, and it would work like a miracle, and he was absolutely right.
The second strike is that on examination I find that the pain is coming from that joint. The third strike is that the X-ray shows arthritis, and only if these 3 strikes come together do I recommend joint replacement surgery in a patient.
I was not afraid of the surgery only because when I met Dr. Karkare, I liked him and I trusted him right away, and I knew I was in good hands. And the way he does it is the best way to do it, because he does anterior surgery, which is done in the front of the thigh, rather than the posterior surgery, which is done on the side of the thigh. And it's less invasive that way and faster recovery.
It's a muscle sparing approach to the hip joint in which absolutely no muscles are cut at all. You go between the muscles and do the hip replacement. The advantage of that is that the risk of dislocation after a hip replacement is very minimal. The rehabilitation is very fast. After a hip replacement, I make my patients stand up and walk the same day of surgery if they're able to do that. Next day they're definitely walking with a walker, and then they progress to walking with a cane to no support at all.
When I was in rehab after surgery, there were other people there who had hip surgery also, and they had the posterior, and their rehab went slower than mine. I was running circles around them, even though some of them were younger than me. I was definitely more advanced.
Hip replacement surgery is one of the most satisfying surgeries in orthopedics. What we do is replace the ball and socket type of joint. As you can see here, on the cup side we replace it with metal and plastic, and on the thigh bone side we place a stem inside. There is a head that goes on top of the stem, and then we put that together in the surgery. How are you doing?
Good, fantastic. Getting ready to go back to work tomorrow.
Okay.
You did a great job.
Thank
now
you.
you got to fix my knee.
How does the hip feel?
Fantastic, no problems whatsoever.
Excellent. Any pain in the hip at all?
None whatsoever.
Excellent. All right, we can bend it all the way.
Now I feel great, ready to get back to normal. I'm going back to work, happy. No problem either. That's fantastic. I'm normal.
I get my patients up and moving very quickly after their joint replacement surgery. I therefore do not need to use what we call as potent anticoagulant drugs like Lovenox or Coumadin. What I use is aspirin. Aspirin has a huge advantage. It provides excellent pain relief. It does not need any needle sticks for checking things like INR, which is needed after using potent anticoagulant drugs, and the risk of bone formation in the joint is very less. What that results is in excellent range of motion after any joint replacement surgery. The arthritis is gone, that's history. And you can see that.
That's amazing.
Yeah, you can see that the stem is also very nicely fixed. This X-ray looks great. So does this X-ray. X-rays are fantastic. You're doing very well.
I have to tell you one thing about him. He's fantastic. His bedside manner is out of this world. I can't ask for anything better. I've had other surgeries, and this is the first time I've had a doctor check up on me at home and in recovery where, you know, for days after the surgery.
I treat my patients like family. I provide individualized care to each patient. whether a patient is having a hip replacement surgery, knee replacement surgery, or if I'm fixing a fracture, I tailor the patient's needs to the equipment that I use. And I try to make sure that the patient is up and moving as soon as possible.
Now I can bend, I can put my own shoes and socks on, I can get dressed with no pain, I can take a shower without having to be afraid of falling in my bathtub. Everything moves, everything works. I'm very, very happy with this surgery. I'm very happy with him, 1000% all the way around.